I'm Charles Goodacre, and I have the privilege today to talk with two very distinguished individuals, Dr. Peter Moy and Dr. James Chow, who have established themselves as experts in the field of implant dentistry. And for those young individuals who are planning a career, I thought it'd be interesting to get your perspectives on how did you develop your career. So, Dr. Moy, tell us a little bit about your background and how did you come to where you are today?
I've come to where I am today thanks to P.I. Bronnemark. I'm fortunate to be one of the last group of prosthodontic surgical teams that was actually trained by P.I. Bronnemark in the U.S.
What year was that?
1983. So I was still just a baby. But the impression that P.I. Bronnemark made on me was such a lasting impression, and I accepted his teachings and his principles. The thing that I remember most from P.I. Bronnemark was the 5 Ps. When he taught us to be a good surgeon and constantly try to achieve perfection. And his 5 Ps stood for persistent precision, provides predictable prognosis. And just following that concept allowed me to at least achieve as high of a success rate as possible. And so I think that following those principles made me what I am today.
And tell me a little bit about your educational background too. That certainly is part of how you got to be where you are.
Yes. Again, I am fortunate in that I had the ability or capability to develop what I call a hybrid practice. What I mean by that is that I had the benefit of starting my own private practice, and I worked in private practice for up to about 5 years before I had the opportunity to join the faculty at UCLA. And at that point in time, I didn't want to go full-time faculty because then I would not have the ability to provide the clinical experience that I had in private practice. And so I was able to convince the dean to allow me to go 50% time. And I have been that for now 35 years.
Sounds like you had a dean who was willing to be innovative and flexible because he recognized the potential that you would have in contributing to the education at UCLA.
Well, you need a lot of luck, you need a lot of support, and I had both at UCLA.
Excellent. Dr. Chow, tell us a little bit about your journey. How did you come to achieve the level of excellence that you have attained?
I think my story is more simple than Peter. I actually finished my postgraduate training in 1993, and then at that time I got a chance to attend a implant training course organized by Nobel Biocare at that time. The course was conducted by a team from Australia, so including a surgeon and a prosthodontist. And then immediately after attending the course, I have the gut feeling. I know the dental implants is something coming back in the future. So I start talking to my colleagues. This is something all of us have to learn. And then at the time we start, talking to Nobel Biocare team, Hong Kong, And then immediately we start, acquire some of the component, the equipment, and then we start treating our patients. So everything was happening like this. It's actually not very, not a very attractive story, but I think it's quite an opportunity for me at that time. And then since in 1993, not many dental colleagues in Hong Kong, they were actually doing dental implant. So we at that time actually received a lot of opportunity to meet experts from all around the world, and these activities were also facilitated by Goodacre Hong Kong at that time. So we met many experts from Sweden, from Canada, from United States, including Chow, Dan Torman, Neil Meredith, and Freebird, and Uwe Lecon. So at that time, I didn't realize all these are really big names in implant dentistry, but we benefit from learning from each of them. So my experience is we have to stay foolish, stay hungry, and then we have to meet with different colleagues, mentors. We have to connect with them, we have to learn from them. And for the years, even up to now, I think I still believe this is the way to go on, to learn, to practice, to improve. So basically it's like this.
Thank you. Dr. Moy, young professionals who want to really establish themselves, what advice would you give to them who are trying to, let's say, improve themselves and become better?
That's a difficult question to answer, simply because everyone's experience is so different. And, you know, my feeling for them is, in a way, I'm sad for them. In a way, I'm jealous of them, right? I'm sad because they will never have the experience of meeting P.I. Bronnemark, getting to know his infinite wisdom, his charm, but most importantly, his concerns for his patients. I think one of the famous sayings is that it doesn't matter what the cost is. If it will improve the outcome for your patient, you should do it. And so my suggestion for the young leaders of tomorrow is to put your patient first. Always do the best that you can for them, regardless of what the cost will be. And I'm jealous because you see all of the innovations that are being introduced today. I mean, there's new innovations almost on a daily basis. And so it makes their practice of implant dentistry a lot easier. But that doesn't mean that you shouldn't be persistent in your attempts at achieving perfection. So my recommendation to them is work hard, don't look at the cost, and do what's best for your patient.
Excellent advice, absolutely. James, tell us a little bit about your perspective. What advice would you like to give that young professional who's trying to improve themselves?
Firstly, I agree with Peter because when I started working with dental implant in 1993, at that time we had plenty of opportunity to meet Professor P.I. Bronnemark. So we went to Gothenburg, Perth, and Brazil. So we receive training from him directly, and I think in addition to what Peter already told us, we learn from PI, it is very important. We have to have the passion on our profession. So be passionate, and then we have to have a mindset of lifelong learning. And especially nowadays, we are in a digital age. We have what we call abundance of information. So critical thinking is another thing we have to develop, because we have to really select what is the right to learn. But whatever the knowledge is, patient is always the first. Without this kind of mindset, no matter how good is our skill, I don't think it is something which can last long or persist.
You mentioned lifelong learning. How would you propose to the young individual? What's a good way to maintain your lifelong learning so that you really keep up to date?
I think changing is constant nowadays. That means every day we encounter new technique, new knowledge, and it is easy. Of course, nowadays we can learn it from the internet, but I think the best way, as I mentioned at the beginning, is to meet people, to connect with people, to learn from these people. And what I mean is they are colleagues, they have expertise in different areas. There are colleagues maybe in our location, or they are colleagues internationally, and don't consider the cost. We have to really, just spend our time and effort to travel, to see. The world is huge. Even we say it is flat, but there's so many things, there's so many people at least for me, I am very eager to see and to learn. And after practicing for over 30 years, I think I still have the heat inside my body. When I think about there's something I can learn, there's something I can improve, I feel excited. So I'm happy to learn from other people.
Now, that's also exactly the way I feel. This is my 52nd year of clinical practice, and I still get enthused to try to develop new ideas, to try the new techniques and procedures and materials, and that keeps me going. Now, both of you have mentioned, the Professor Brownemark, certainly one of the icons of the past, and unfortunately our young individuals will never have the opportunity to meet him. Whoever are the so-called experts of the time, do you think it's valuable that they spend time with those people, whoever they are today, even though some of the icons of the past are no longer with us? What do you think? Should they go spend time with the people that know a lot today? Is that valuable?
From a personal standpoint, I think it's extremely valuable because, as James said, it's a lifelong learning experience. And I think this is why James and I are co-chairs of the Education Council for FOR. And it's a great platform for our young leaders of tomorrow to get that training, education, knowledge, whatever you want to call it, through the educational process. I personally love to teach, not because I'm a good teacher, but I'm learning from the people that I'm trying to teach. They challenge you, they ask questions, and as a teacher, you feel obligated to come up with the right answer. And so that keeps my nose in the textbooks. I know the young ones don't look at textbooks today, but education is a lifelong process. And again, I can't speak enough for the foundation on oral rehabilitation.
And they've, of course, developed the Emerging Leaders Program, which gives some very unique opportunities for young individuals to come together, learn from each other, learn from some experts. And
Yes.
I fully agree with Peter. I mean, I like teaching too, but I always see teachings as a process of learning. Every time I teach, I have to study before I present or I conduct a course. And then I will review my cases, I will review the literature, and then every time I see something different, something new. And it is also very joyful to see the younger dentists, they are rising. They are rising up, and then they have all sorts of talent, and then they are also share the same passion as us.
you know, every year when I start teaching a new group of students, I give them this charge. I tell them, here's what I want from you. I want you to become more knowledgeable and more skillful than those of us that are teaching you. And it's only that way that the profession can really advance. Now, some of them sit back and they're saying, well, how in the world can that ever happen? And my greatest satisfaction is when I have some students who actually do that. They go way beyond my capabilities, and that's how things can really progress.
Absolutely right. Absolutely.
Well, I thank both of you for spending some time and sharing your knowledge and experience. You certainly both have contributed so much to the profession and to implant dentistry, so thank you very much for your time.
Thank
Thank you, Charlie.
Thank you.
Thank you.
My pleasure.